Hi everyone, my name is Eleni Pitsinyaga and I'm the host of UnravelingRare. Today we have with us Manuela, who is the founder of the CHOPS Foundation and a mother who's helping her child find CHOPS. So Manuela, I'd like for you to introduce yourself and tell us about Mario's diagnosis and his journey to diagnosis.
Hi, Eleni. I'm very happy to be here and to tell you our story and what allow us to be here as a foundation. So, actually, Mario's Odyssey started in the exact moment of his birth because I had an emergency C-section after 9 perfect months of pregnancy. And then after the first couple of months, everything seemed pretty normal for us, for me, and for my husband. But first suspicions started when we were on holidays. That was our first summer holiday. Mario was 4 months old, and we realized that he was somehow tired, less reactive with respect to the other children of the same age, and so that moment was the how to say when we realized that there was something wrong with Mario, that there was something that we have to understand better. And then during the same summer, he also got a bronchitis. We did the first heart check and we had the first diagnosis because doctors told us that Mario had multiple interventricular defects. So Mario has already had two important surgeries. One when he was 6 months old, and the other one when he was 1 year and a half. Um, and because of this, he has to spend something like 4 months of his life in a hospital. Um, at the same time, that allowed doctors to observe Mario for a long time, and we started soon with genetic tests. And finally, after more or less 1 year and a half, Mario received his diagnosis. He was around 2 years old, and we had the name Mario as CHOPS syndrome. And another thing that is important is that Mario's doctors told me that he was so similar to another patient they have, who is affected by the same disease, and that was incredible for me, given that CHOPS is really an ultra rare disease.
What I understood from your background is that it's really difficult to get a CHOPS diagnosis. What are some day-to-day challenges that your family is facing with CHOPS?
First of all, we live with the oxygen tank because Mario had many respiratory issues. And after the second heart surgery, we came back home with the oxygen support. So he had to wear oxygen mask 24 hours per day. That was very challenging for Mario and also for us. And that's why me and my husband decided at a certain point to change completely our life. We moved near the sea more or less 1 year ago. Now we live in Sicily, but our home is still in Padova, which is a nice town near Venice in the north of Italy, where we spent 15 years of our life. So that was difficult for us, but it was a good decision because Mario incredibly improved from the respiratory point of view. And he now uses oxygen only when he gets sick or sometimes during the night. So this is a big improvement. But I see that most of CHOPS kids share the same respiratory issues, the same respiratory sensitivity, and the cause is still not very clear. In addition to this, I can say that Mario must do his therapies 5 times a week. He does physiotherapy 3 times a week and speech therapy twice. Um, and because this is because even if he is almost 3 years old, in March there will be his birthday. Um, he cannot walk and he cannot speak. He does not say mom, dad, nothing, but is incredibly communicative. And I actually see that all CHOPS kids are, and communicating is a real struggle for them. And most of them are nonverbal. So this is another important challenge for CHOPS, the speech and the cognitive part.
It's interesting that you mentioned that Mario got a diagnosis so much faster than the other CHOPS kids. Do you think this is because of advancements in, science research about CHOPS, or maybe more awareness, so doctors and scientists kind of know to identify it sooner? Like, how come Mario's was so fast?
I think that in the case of Mario, we can talk um, uh, about the fact that he was lucky. He was simply lucky because there was another patient who is now almost 15 years old, and doctors told us, okay, Mario is very similar to this patient, so we will do a test, which was not the exome. They analyzed only a small portion of Ep04 gene, which is the gene where CHOPS mutations are localized. And in that case, Mario was simply lucky, because otherwise, I think that his diagnosis would have arrived only some months ago, because the exome will take 1 year, more or less. So I think that now, with our foundation, things are going to change, because we are talking about shops everywhere, and I hope that now doctors will start to be more aware about this disease. But I hope that with what we are doing with our foundation, this disease will start to become more, how to say, more known. Yes.
Yeah, and this is also something that, the CHOPS Foundation is exploring with Unravel Biosciences, since Unravel is collecting, RNA-seq data in order to identify maybe new target mechanisms using existing targets. And I was just wondering, how do you think, our partnership, CHOPS Foundation with Unravel, could actually help find a cure, or, help extend treatment for CHOPS?
I think that we must make key partnership to develop possible therapies, and Unravel has found a way to align its corporate strategy with the immediate needs of these foundations like mine. So I have to say also that our foundation aims at funding some basic research to elucidate the underlying cell biology and genetic of these diagnoses. But, uh, but our mission is to drive and accelerate targeted therapies for CHOPS syndrome. And I think that Unravel can rapidly identify existing drugs that may benefit CHOPS children. And I think the most important thing is that the possible rapid clinical impact of Unravel matches with our urgency of finding a treatment for our kids. I am seeing that drug companies sometimes make thousands of new chemical compounds, and they check one by one to see if they are applicable to treat given diseases. But being these procedures very complex and very expensive, the companies mostly focus on common diseases where they can recoup their investment essentially. And it is common for a company to spend something like, let's say, 5 years and tens of millions of dollars making a new drug. And I think that our Ravel bioinformatic approach is very efficient and very rapid, and it can identify potential drugs for CHOPS very quickly. We may be extremely lucky and find that a drug that millions of people take every day has the potential to help out our kids, our our CHOPS children. And that will be a big win for any foundation. But I have to say also that some drugs maybe are not good for a long-term use. And in that situation, Unravel and our foundation will cooperate in a program to modify the existing drug in order to develop a better version. And the foundation will feel secure that they were on a a productive path, and Unravel may get a drug that is applicable also to other diseases that are related to CHOPS.
Yeah, because even Cornelia de Lange syndrome has so much overlap with CHOPS syndrome. So how do you see opportunity for these two syndromes to kind of be fought in a similar way, maybe using similar therapeutics?
So, as I said, I am not an expert at all in this field, but I think that we have to build connection between different groups, so doctors, researchers, and families. And in this case, the role of patients in the field of ultra rare of rare diseases, and of course in the field of ultra rare diseases, the role of patients is pivotal. And about Cornelia de Lange, we know that it is similar to CHOPS at the molecular level because both CHOPS and Cornelia involve defects in the same cellular machine. Actually, our project with Unravel will involve a subgroup of Cornelia patients which have a specific mutation, which is the HDAC8 mutation. And if the drugs we discover can somehow bypass or improve the efficiency of the altered machine I was talking about, maybe both Cornelia and CHOPS can benefit. Both subjects can benefit. So that is very important.
As a mom and an advocate for CHOPS, you've done so much important work, and I know that there's a lot more to go. What do you think is necessary in order to accelerate effective treatments for CHOPS and, help these kids get one step closer to a therapy?
So I think that is important to connect different areas of expertise. The role of our foundation is to bridge these different areas. So to connect doctors, researchers, and then families to share information, because also sharing data is so important in this case to improve our knowledge. So, in order to accelerate this path, I think that we will try to do our best in this sense in order to connect as much as possible all the different communities. No, I think that, of course, as a foundation for us, it is mandatory to raise awareness. This is another important point. Um, it is related to to the fact of accelerating the path towards therapy, because if you raise awareness, if you talk about your life, what your child has, which are his or her daily challenges, you can maybe you can receive more help by donors. And so it is something, all the pieces are important. So it is important to raise awareness, to find possibly other people who are affected by the same disease. This can be an inspiration for other group of patients, and then you can also have more people who decide to support you. And this is important because we want to fund big projects. So I think that these are also key aspects for accelerating our path.
Yeah, definitely, definitely. Those are some very good points that you just raised. And this is the end of the podcast. I'd like to thank you so much for participating, and thank you so much for extending your insights and all the hard work that you do for fighting against CHOPS syndrome. I would like you to maybe give us some parting thoughts, maybe something that you'd like to tell parents or families who are fighting against CHOPS syndrome, or just a note to people who want to learn more about CHOPS syndrome.
So I would like to conclude only by saying two things. One is a big thank you to Lainey Mosley, because when we received this diagnosis for Mario, um, there was not so much, but there is this support group which was founded by her, and that was a very very good starting point for me, and an inspiration to do something, because now our foundation is the first no profit, the first no profit with this clear mission of finding a cure for CHOPS. But we started from something, and that was realized by another mom, who is an important part of our foundation. And then I want to conclude by saying that I do believe that nowadays a diagnosis must be the starting point, and not the ending one. And I really hope that this message can arrive to other parents who are living a similar situation.
Manuela, thank you so much. It's been such a pleasure to have you on the show.
Thanks to you, Eleni. It was a pleasure for me.